2 years ago, the Georgetown Scott County EMS team started a critical incident team to provide mental health resources to its paramedics. Now the program serves multiple agencies within Scott County, including the fire department and the coroner's office. First responders say they have experienced a stigma around mental health in their field, but the critical incident team is helping to make a difference. That's tonight's medical news.
On May 22nd, 2023, Scott County lost Deputy Caleb Conley in a really violent line of duty death, and that kind of brought attention to mental health and mental well-being for first responders, especially for those who worked the incident. We saw that there wasn't really a huge list of resources for first responders when it comes to mental health and dealing with hard calls and even just day-to-day life. And then recently we saw a greater need for all the first responders in the county, not just EMS. We are made up of EMS, police, fire, sheriff's department, coroner's office, dispatch, and some local hospital.
We of course want to be a part of it because we all are brothers and sisters here in emergency services. Whether you've done this for 5 minutes or 15 years, you have experienced things in your career that are very traumatic, and you either hold on to it or you have to have an out, and you have to have a way to deal with those emotions. And so being a part of this team allows us to help each other, take care of each other, and make sure that we don't have any burnout and reduce the amount of burnout, and make sure that we're all providing the best service we can.
The human brain's really only wired and meant to witness and survive 1 to 3 traumatic events in their lifetime. And first responders, we can see double or triple that in a shift, just kind of depending on how the day goes. And then there's been this big stigma that, we're the tough ones. Like if you had a hard call or whatever, get over it and move on to the next one. But then that's led to a lot of post-traumatic stress disorder, depression, anxiety, and we've even lost several first responders, not necessarily here in Scott County, but throughout the state of Kentucky, to death by suicide because of what we see and not being able to deal with it. We can provide incident debrief, so like hard calls, wrecks, fires. Pediatrics are typically really hard on first responders if there's a tough pediatric call. So we can do incident debriefs. We also provide peer support. So if somebody is just like, hey, I'm having a really hard time and want to speak one-on-one in kind of an informal setting, all of our members are either trained or getting trained in peer support as well.
It's been pushed to me that when I was very young that, hey, we're tough, we're strong, we can do this. You hold it down, we don't deal with it and out in the open. Well, that's just not true.
I think people are finally starting to realize that first responders are also human, and I think first responders are starting to realize, like, hey, we are still human at the end of the day. We also have to take care of ourselves. It's really hard to take care of other people if we're not taking care of ourselves.
Very true. The multi-agency critical incident team had its first meeting earlier this month.